To what group of drugs does Grandaxin belong?
Grandaxin belongs to the class of drugs known as anxiolytics. That is, they are tranquilizers derived from the benzodiazepines.
What is the primary active substance in the drug?
The main active ingredient is Tofisopam. It is a drug which produces a calming and relaxing effect on the central nervous system.
And what are the effects of the drug? How effective it is as a treatment?
The drug has a very positive effect that can be primarily observed during the day. It removes anxiety and stress, that is, psychological stress. It takes away worry and fear. While taking away these negative emotional states, the drug simultaneously treats and prevents autonomic dysfunction.
So, to a certain extent, you could say Grandaxin possesses a calming effect?
Yes, of course.
Is Grandaxin available over the counter or only by prescription?
Yes, of course. It's psychoactive substance in anxiolytic family, so it's only available by prescription and only administered by a doctor's order.
In what doses and forms is Grandaxin available?
It is sold in 50 mg tablet form. On one side of the pill, there is a scored line to make them easier to split and administer doses according to the age of the patient. The name of the drug is embossed on the other side to ensure that it is not mistaken for different pills of the same color. Sold by Hungarian company Aegis, and it is a brand name drug. It doesn't have any direct substitutes, and since it's a high quality product, we've been using it for a long time in neurology and psychiatry. Here we're talking decades.
For what conditions is Grandaxin prescribed?
Its indication for use are quite broad. Firstly, it includes neurotic disorders and neurosis. It can also be used in treating neurotrophic syndrome. This is because its effect is not only calming, but also stimulating. The most important thing is that it doesn't induce sleep like other diazepines. It doesn't act as muscle relaxant. It doesn't cause lethargy, inhibit reflexes, or cause tiredness. This is an enormous advantage for people taking the drug for neurosis, and it does not diminish activity during the day. In this respect, it is a daytime drug which generally removes barriers such as anxiety, worry, self-doubt, uncertainty, dysautonomia, heart palpitations, lowered blood pressure, changes in pulse. Sometimes it could be sweating or dry mouth, nervous system changes related to internal and external organs, the respiratory system, and the cardiovascular system.
So Grandaxin helps in cases of vegetovascular dystonia, tachycardia, conditions accompanied by a rise in blood pressure, rapid pulse, for example, panic attacks?
Yes, anxious states, worries, panic attacks. However, in panic attacks we use it as a prophylactic. That is, it alleviates these conditions such as phobias and anxiety. It's mainly used to treat anxiety. It's also important to know that it can also be useful in treating various forms of vegetovascular dystonia.
Can the drug be used to deal with intrusive thoughts?
In this case, the drug isn't beneficial. It is a bit less effective in treating phobias and intrusive thoughts.
Can Grandaxin be used to treat withdrawal syndrome in alcoholics? And if so, can it also help with smoking cessation?
Well, in this case, we are already talking about drug rehab treatment. When treating addiction, we understand that withdrawal syndrome consists of somatic, neurological, and vegetative symptoms. It can specifically help to alleviate vegetative symptoms present during withdrawal. Grandaxin works very well to lessen the symptoms of withdrawal from alcohol. Regarding tobacco cessation, drugs like Mebixar and Adaptol are more commonly recommended. However, Grandaxin may still be applied.
Can Grandaxin be taken to reduce anxiety and fear before exams? Or are there any other drugs from this group of tranquilizers that could be used?
Well, seeing as many people get the jitters, athletes, children, and teens studying for exams, we understand that excess worry and overexertion can lead to poor performance even when person is prepared. We have to do all that we can to make sure the mind is clear and to remove fear and worry. That is, we have to eliminate this adverse emotional and vegetative conditions so they don't interfere with concentration. Therefore, Grandaxin can of course be used in small doses for a period of 2 or 3 days. We call for a short course of treatment to prepare, as there is slight activating effect. However, in these cases, we can also apply other drugs, for example, glycine or vasovital. These drugs can help increase concentration and memorization. Pentagon is another one.
It's just that Grandaxin has some possible side effects: vertigo, nausea, vomiting, allergic reaction, and headache.
If we are speaking frankly, this drug, which has been used for a long time in medicine, over 30 years, is known by practicing doctors to produce mild side effects, and even then only rarely. It's typically on the individual basis. Sometimes the drug can create an utterly paradoxical effect. However, in these cases, it is usually not a terrible complication. Occasionally, allergic reactions may manifest. The patient might have headache or trouble sleeping. Basically, these are complications that are easily treated by ceasing treatment or lowering the dose.
Does Grandaxin affect weight? Can taking it reduce appetite?
In modern medicine, side effects and additional effects are part of the process of applying the drug. This can be viewed as an additional effect. This drug performs two functions. It helps to alleviate stress, worry, and vegetative disorders, while simultaneously regulating appetite by removing stress eating.
What effect does the drug have on blood pressure? Does it raise or lower it?
We can call this drug a psychovegetative character. That is, it evens out the vegetative nervous system and helps to regulate vegetative disorders. We often treat women as they are more often seek treatment for anxiety. Raised blood pressure, that is, spikes in blood pressure, can be very frightening even to hypotonic persons. However, when dystonia is present, or it is connected to a hormonal imbalance, or the result of menstruation or menopause, these vegetative changes might cause anxiety. The drug helps lower blood pressure, remove stress, and improve general condition.
You were saying that the drug affects the digestive tract. Why do patients taking Grandaxin sometimes experience stomach pains?
It happens very rarely when a patient has taken too much of the drug. It might occur where severe neurosis is present to the point of agitation of the digestive tract. These manifestations might not even be connected to Grandaxin.
Does taking Grandaxin have any influence on virility?
As opposed to other benzodiazepines, Grandaxin doesn't cause lethargy or somnolence. As a rule, a reduction in virility is not observed because it has low active dose. This drug isn't harmful to men.
Does the drug lower reflexes or concentration? Can people who spend a lot of time driving take the medication?
Grandaxin is considered a daytime tranquilizer. This means it can be used in the morning, the daytime, and of course in the evening. It doesn't interfere with driving, worsen or slow reflexes. It doesn't make the driver lethargic. Not only it is calming, but it regulates and removes anxiety. People are often afraid behind the wheel of what might happen, and the drug helps to fight these fears. That is, driving is permitted while taking the drug.
For how many days and what dose is Grandaxin taken?
As a rule, the drug should be taken 3 times a day. Considering a single tablet is 50 milligrams and keeping in mind body mass, the medical practitioner, and symptoms, we sometimes prescribe 1/2 to a full tablet 3 times a day. If needed, the maximum dose can be increased to 6 tablets a day. That is, if necessary, 300 milligrams a day.
Is the drug taken before or after meals?
In the official literature, it is stated that the drug has no effect on the consumption of food, but from doctor's experience, it is recommended to take it with water 30 minutes after eating to avoid any possible gastrointestinal side effects, nausea or vomiting. In this way, complications affecting the stomach and other organs can be prevented.
How long is the course of treatment with Grandaxin?
Keep it in mind, it is a tranquilizer. There is an anxiolytic. It is in the benzodiazepine family. It is used for 2 to 3 weeks at a time. We try to achieve the needed effect during that time, so there aren't any complications, increased tolerance, or side effects.
How quickly does the drug take effect?
It has been noted that maximum concentration in blood is reached after 2 hours. In other words, you take the drug and experience the effect. In clinical practice, this effect regarding symptoms such as anxiety, stress, fear, and vegetative dystonia is observed on the 2nd, 3rd, or 4th day. So patients don't have to wait very long. The full effect of the drug is felt after 2 or 3 days.
How often can courses of Grandaxin be administered? How many times a year?
Well, usually we apply it twice a year. We take into account the recurrence of symptoms and recommend a course of treatment involving drugs from various groups. Or we may prescribe a sedative or other kind of tranquilizer to produce the needed effect. The primary objective is to heal the patient.
Have withdrawal syndrome been observed after stopping Grandaxin?
When stopping the Grandaxin, what are we worried about? No, there is no withdrawal syndrome, but symptoms may worsen. Doctors want to make sure that the length of the remission is as long as possible and that the patient feels that they are improving without the drugs. That's why we try to minimize the dose and, at the end of the session, move to the drug therapy. We only use it when the patient experiences worry, anxiety, or other unwanted symptoms. After this, we finish the course of treatment in 2 or 3 weeks. In other words, we do everything we can to wean patients off the drugs gradually.
How long does Grandaxin take to leave your system?
It completely leaves your system within 12 to 14 hours through the kidneys. That's why it's important to prescribe the drug to patients with healthy kidney function to avoid side effects.
Can this drug cause tolerance or dependence?
This drug is unique in that physical dependence has not been observed, nor has withdrawal syndrome. Of course, the psychological sensation of comfort is attractive to many patients. That is, when taking the drug, they feel calmer and more self-assured. However, this is purely on psychological level. That's why it's crucial for us to move on other drugs, phytotherapy and sedatives, to make sure this kind of dependence doesn't happen.
Is it possible to overdose on Grandaxin?
In practice, this is very rare. To overdose, the patient would need to take 150 milligrams per kilo of body weight. So, if we take a woman who weighs 70 or 80 kilos, she would have to take 70, 80, 90, possibly 100 tablets. This would be a suicidal act, and therefore this drug is not recommended for patients with depression or psychosis. There are other drugs for that. When the drug is reasonably administered, we can easily avoid complications, side effects, and overdose.
Who else shouldn't take Grandaxin?
Well, in general, it isn't recommended for those with acute conditions such as kidney disease, respiratory illnesses, especially problems with breathing, intolerance to tranquilizer or benzodiazepines, and of course, in cases of depression and psychosis.
Is it recommended to take this drug while breastfeeding or pregnant?
This drug is not recommended for women who are breastfeeding. With treating pregnant women, we understand that gynecologists and midwives may prescribe a litany of drugs. This is all done strictly on an individual basis. That said, we can recommend the medication if there are symptoms present and the woman is in her 3rd trimester.
What age may children take Grandaxin?
With children, we try to use different classes of drugs. If there are symptoms present and it is necessary, children from 12 to 14 can take Grandaxin.
In what doses can teenagers take Grandaxin?
The tablets have a crease indicating where they can be divided. Therefore, it is advised teenagers take half a pill, 25 milligrams, once or twice a day. However, this is in situations where there is marked anxiety, self-doubt, vegetative disorders, and when neurotic and acetylneurotic disorders are interfering with the child's ability to function. The drug is administered for short-term treatment and should always be accompanied by psychotherapy, with the goal of individual development and healing. That is, it isn't a standalone treatment, it must attend psychotherapy.
How does Grandaxin interact with other drugs?
This is more important than taking the drug. When we are talking about Grandaxin as a member of anxiolytics class of drugs, keep in mind that it strengthens the effect of other tranquilizer. That is, it applies and forms a kind of synergy. It can also increase the effects of anesthetics, narcotic pain medicines, and psychotropic drugs. It may also compound the impact of certain allergy medications.
Are there any analogues to the drug?
There is no direct replacements for it, but within the diazepine family, there are drugs such as diazepam, temazepam, phenazepam, gidazepam. These are all from the same group of drugs.